Welcome to the 4500 NCLEX question series. This is practice video 3, where we will discuss questions from 226 to 300. To master all 4500 previously asked questions, be sure to watch all 30 episodes of the series. Let's dive in and get started with question 226. An infant holds his head to one side. What is the likely diagnosis? A. Neck muscle spasm. B. Head flattening on one side. C. Increased head size. D. Premature suture fusion. Correct answer. A. Neck muscle spasm. Neck muscle spasm, torticollis, causes the head to tilt to one side due to muscle contraction. Head flattening involves skull shape, not neck tilt. Increased head size, hydrocephalus, affects head size, not neck position. Premature suture fusion affects head shape, not neck position. Great job. Now let us talk about atherosclerosis. A patient is worried about atherosclerosis risk factors, which is hereditary. A. Diet. B. Smoking. C. Family history of heart disease. D. Obesity. Correct answer. C. Family history of heart disease. Family history is a genetic risk factor and cannot be changed. Diet and smoking are modifiable risk factors, and obesity is also modifiable through lifestyle changes. Moving on, let us do a dosage calculation. A child weighing 30 kilograms is prescribed diphenhydramine 25 milligrams 3 times a day for itching. The pediatric dose is 5 milligrams per kilogram per day. Is the dose correct? A. Adjust based on symptoms. B. Yes, it is correct. C. The dose is too high. D. The dose is too low. Correct. Answer. D. The dose is too low. The correct dose is 150 milligrams per day, 5 milligrams per kilogram multiplied by 30 kilograms, and the prescribed dose totals 75 milligrams per day, which is too low. Dosage adjustments should be made by a physician. The prescribed dose is not correct, and the dose is not too high. Now, let us consider a trauma scenario. A nurse observes a 4-year-old with head trauma. What sign indicates increased intracranial pressure? A. Difficulty reading. B. Repeated vomiting. C. Sleepiness at bedtime. D. Swollen soft spot on the head. Correct answer. B. Repeated vomiting. Repeated vomiting can be an early sign of increased intracranial pressure due to medulla stimulation. Most 4-year-olds cannot read yet. Sleepiness at bedtime is normal for this age. Soft spots, fontanelles, close by age 2. Next, let us talk about arthritis management. An elderly patient with arthritis is ready for discharge. Which statement is correct? A. Anti-inflammatory drugs should be taken on an empty stomach. B. Acetaminophen is more effective for inflammation than ibuprofen. C. Joint pain will lessen after a full night's sleep. D. Increasing physical activity and regular exercise will help reduce joint pain. Correct answer. D. Increasing physical activity and regular exercise will help reduce joint pain. Regular exercise helps maintain joint flexibility and strength, reducing pain in arthritis. Anti-inflammatory drugs should be taken with food to prevent stomach issues. Acetaminophen is a pain reliever, but does not have anti-inflammatory properties like ibuprofen. Pain and stiffness are often worse after periods of inactivity, such as overnight. Let us switch to Raynaud's phenomenon. A patient with Raynaud's phenomenon complains of cold and stiff fingers. Which description fits the patient? A. Teenage boy. B. Elderly woman. C. Young woman. D. Elderly man. Correct answer. C. Young woman. Raynaud's phenomenon is most common in young women and often linked to autoimmune disorders. Teenage boys, elderly women, and elderly men are less likely demographics for Raynaud's phenomenon. Next, let us consider the characteristics of an abusive parent. What characteristic is least likely in an abusive parent? A. Blaming themselves for the child's injury. B. Low self-esteem. C. Single parent. D. Joblessness. Correct answer. A. Blaming themselves for the child's injury. Abusive parents typically blame the child or others for injuries rather than themselves. Low self-esteem is common among abusive parents. Single parent status is often found in abusive situations, and joblessness can be a contributing stress factor. Let us move to a labor and delivery scenario. A patient in labor undergoes an amniotomy. Which statements are accurate? Select all that apply. A. Contractions may become more intense and frequent. B. The fetal heart rate, FHR, will be closely monitored due to the risk of cord compression. C. The procedure is usually painless and followed by a gush of fluid. D. Frequent cervical checks will be necessary. E. The procedure is painful. Correct answers: A, B, C. Amniotomy can lead to stronger, more frequent contractions and potential cord compression, necessitating close FHR monitoring. The procedure is generally painless and results in the release of amniotic fluid. Frequent cervical checks should be minimized post-amniotomy to reduce infection risk. The procedure itself is not painful. Next, let us consider post-operative care. A nurse is evaluating a post-operative patient and notices a moderate amount of clear fluid on the dressing 24 hours after surgery. What is the best nursing action? A. Remove the dressing and leave the wound uncovered. B. Change the dressing and note the wound's condition in the chart. C. Immediately call the surgeon to report an infection. D. Keep the dressing as is to avoid disrupting the wound. Correct answer: B. Change the dressing and note the wound's condition in the chart. Moderate clear drainage is typical in early wound healing. Changing the dressing prevents bacterial growth and allows for proper documentation of the wound's status. The wound should remain covered to protect it from contamination. Clear fluid does not indicate infection, which would appear as pus. A soiled dressing should be replaced to prevent infection. Let us talk about blood transfusion reactions. A patient who received 2 units of blood is now short of breath and uncomfortable with lung crackles. What is likely happening? A. Fluid overload. B. Allergic reaction. C. Hemolytic reaction. D. Febrile reaction. Correct answer: A. Fluid overload. Fluid overload occurs when too much fluid is infused quickly, leading to symptoms like dyspnea and lung crackles. Allergic reactions include itching and rash. Hemolytic reactions involve fever and dark urine. Febrile reactions usually involve fever. Now, let us discuss newborn care. A nurse advises the mother of a newborn with jaundice. Which instruction is incorrect? A. Keep the baby in a dimly lit room to rest. B. Follow up with the doctor within 72 hours for bilirubin recheck. C. Breastfeed frequently, at least every 2 to 4 hours. D. Monitor for dehydration signs. Correct answer: A. Keep the baby in a dimly lit room to rest. Exposure to sunlight, not dim light, helps reduce bilirubin levels. Phototherapy is often recommended for high bilirubin levels. Follow-up ensures bilirubin levels are monitored. Frequent breastfeeding helps metabolize bilirubin. Monitoring for dehydration is essential as it can worsen jaundice. Next, let us think about disease prevention. Which strategy is ineffective for preventing Lyme disease? A. Taking antibiotics before going to tick-prone areas. B. Wearing long pants and long-sleeve shirts. C. Applying insect repellent to skin and clothing in tick-infested areas. D. Checking skin and hair for ticks after being outdoors. Correct answer: A. Taking antibiotics before going to tick-prone areas. Prophylactic antibiotics are not recommended for Lyme disease prevention. They are only used if symptoms develop after a tick bite. Protective clothing reduces tick exposure. Insect repellents help prevent tick bites. Regular checks help detect ticks early before they can transmit disease. Let us finish with thrombolytic therapy. Thrombolytic therapy for stroke can cause which complication? A. Larger clot. B. Brain hemorrhage. C. Clot dissolution. D. Air embolism. Correct answer: B. Brain hemorrhage. Thrombolytic therapy increases the risk of bleeding, including brain hemorrhage, which is a significant concern. Therapy resolves clots, not expands them. Clot dissolution is the intended effect, not a complication. Air embolism is not a risk with thrombolytic therapy. Let us keep going. The nurse is instructing a client with a new sigmoid colostomy about caring for the colostomy. The nurse explains that to best regulate the bowel, the client should perform colostomy irrigation at the same time every day. What is the optimal time for doing this? A. An hour before a meal. B. Every 2 hours all day. C. An hour after a meal. D. 2 hours before bedtime. Correct answer. C. An hour after a meal. Colostomy irrigation helps regulate bowel movements by emptying the colon at a scheduled time. It distends the bowel to stimulate peristalsis and promote evacuation. This procedure is most effective when performed about an hour after a meal, when the colon is most likely to be full. An hour before a meal does not take advantage of the natural increase in peristalsis that occurs after eating. Irrigating every 2 hours all day is impractical and unnecessary. 2 hours before bedtime does not align with the natural increase in bowel activity after meals. In an unconscious patient with multiple traumas admitted to the intensive care unit, the healthcare provider has ordered enteral feedings through a nasogastric tube. Which of the following observations made by the nurse necessitates urgent attention before administering the feeding? A. Breath sounds are diminished in the right lower lobe. B. The residual volume of the previous feeding is 90 milliliters. C. Urine output has averaged 40 milliliters per hour over the past 8 hours. D. Bowel sounds are hypoactive in all quadrants. Correct answer. A. Breath sounds are diminished in the right lower lobe. A primary concern with enteral feedings is the risk of aspiration, which can lead to atelectasis and pneumonia, particularly in the right lower lobe. Patients should be positioned with the head of the bed elevated at least 30 degrees during and for up to 2 hours after feeding. Tube placement should be checked before each feeding or every 8 hours for continuous feeding. Residual volumes up to 100 milliliters are typically acceptable. Urine output of less than 30 milliliters per hour should be reported. Hypoactive bowel sounds should be monitored but are not an urgent concern. To obtain the best supply of vitamin B12, which food should be recommended? A. Dairy products. B. Vegetables. C. Broccoli. D. Grains. Correct answer. A. Dairy products. Dairy products and meats are excellent sources of vitamin B12, which is essential for red blood cell formation and neurological function. Vitamin B12 is primarily found in animal products, making dairy a valuable source. Vegetables are not significant sources of vitamin B12. Broccoli, while nutritious, does not contain vitamin B12. Grains do not provide substantial amounts of vitamin B12. Which symptom should an individual with an ileostomy report immediately? A. Liquid stool passing through the stoma. B. Occasional undigested food in the output. C. Slight fever of 37.6 degrees Celsius. D. No output from the ileostomy for over 6 hours. Correct answer. D. No output from the ileostomy for over 6 hours. An absence of ileostomy output for more than 6 hours could indicate an obstruction, which needs urgent medical attention. This could lead to severe complications such as abdominal pain, nausea, or even a complete blockage. Liquid stool passing through the stoma is normal, especially in the initial days following surgery as the body adjusts. The presence of occasional undigested food in the output is also normal and usually not a cause for concern. A slight fever of 37.6 degrees Celsius, while slightly above normal, is not immediately alarming and should be monitored for other symptoms. Which symptom should be monitored as an early sign of laryngeal cancer? A. Difficulty breathing. B. Persistent hoarseness. C. Difficulty swallowing. D. Mouth sores. Correct answer. B. Persistent hoarseness. Persistent hoarseness lasting more than 2 weeks is a common early symptom of laryngeal cancer, especially for cancers affecting the vocal cords. Difficulty breathing is a late sign of laryngeal cancer. Difficulty swallowing typically occurs in more advanced stages. Mouth sores are more associated with oral cancer. After penile implant surgery, a patient's scrotum is edematous and painful. What should the nurse do? A. Elevate the scrotum using a soft support. B. Apply warm soaks to the scrotum. C. Assist with a sitz bath. D. Prepare for possible incision and drainage. Correct answer. A. Elevate the scrotum using a soft support. Elevation of the scrotum helps reduce edema and pain by promoting lymphatic drainage. This positioning also provides comfort and reduces swelling. Warm soaks are not recommended immediately after surgery due to the risk of increasing swelling. Sitz baths are useful, but are recommended several days after surgery, not immediately. Incision and drainage are not indicated unless there is an infection or abscess. A client with chronic kidney disease recognizes an adequate amount of high biological value protein by selecting which food from the menu? A. Whole wheat bread. B. Apple juice. C. Raw carrots. D. Cottage cheese. Correct answer, D. Cottage cheese. Cottage cheese is a high biological value protein containing all essential amino acids necessary for bodily functions. Clients with chronic kidney disease need high-quality proteins that provide all essential amino acids. Whole wheat bread contains some protein, but is not considered high biological value protein. Apple juice is primarily a source of carbohydrates and provides no protein. Raw carrots are high in fiber and vitamins, but do not provide high biological value protein. For a client with myasthenia gravis receiving immunosuppressive therapy, the therapy is effective because it A. Decreases the production of autoantibodies that attack acetylcholine receptors. B. Stimulates the production of acetylcholine at the neuromuscular junction. C. Promotes the removal of antibodies that impair transmission of impulses. D. Inhibits the breakdown of acetylcholine at the neuromuscular junction. Correct answer, A. Decreases the production of autoantibodies that attack acetylcholine receptors. Immunosuppressive therapy reduces the production of autoantibodies that attack acetylcholine receptors at the neuromuscular junction, improving muscle function in myasthenia gravis. The production of acetylcholine is not directly affected by immunosuppressive therapy. Immunosuppressive therapies do not remove antibodies, they reduce production. Inhibiting the breakdown of acetylcholine is achieved with cholinesterase inhibitors, not immunosuppressants. How is a positive diagnosis of HIV confirmed? A. History of risky sexual behaviors. B. Positive ELISA and Western blot tests. C. Presence of an opportunistic infection. D. Symptoms of significant weight loss and fever. Correct answer, B. Positive ELISA and Western blot tests. The presence of HIV antibodies, confirmed through ELISA and Western blot tests, provides a definitive diagnosis of HIV infection. These tests are specific for detecting antibodies produced in response to the virus. A history of risky behaviors increases the likelihood of HIV, but does not confirm the diagnosis. Opportunistic infections are associated with advanced HIV, but are not diagnostic on their own. Symptoms like weight loss and fever can occur in many conditions and are not specific to HIV. What is a common symptom during the jaundice phase of viral hepatitis? A. Black, tarry stools. B. Diarrhea. C. Shortness of breath. D. Yellowing of the eyes. Correct answer, D. Yellowing of the eyes. The jaundice phase of hepatitis is characterized by yellowing of the skin and eyes due to high bilirubin levels caused by liver dysfunction. This is a hallmark sign of hepatitis and indicates liver involvement. Black tarry stools indicate gastrointestinal bleeding, not related to hepatitis jaundice. Diarrhea is not a typical symptom of the jaundice phase of hepatitis. Shortness of breath is not associated with the jaundice phase of hepatitis. Nurse Hazel teaches a client with angina about the common side effects of nitroglycerin. Which side effect should the client expect? A. Headache. B. Stomach cramps. C. Shortness of breath. D. High blood pressure. Correct answer, A. Headache. Nitroglycerin often causes headaches due to its vasodilating effects, which increase blood flow to the brain and can lead to throbbing pain. Stomach cramps are not a typical side effect of nitroglycerin. Shortness of breath is less common than headaches as a side effect. Nitroglycerin typically causes hypotension, not hypertension. What complications should be closely monitored in a client with acute pancreatitis? A. Heart attack. B. Liver cirrhosis. C. Lung infection. D. Stomach ulcer. Correct answer, C. Lung infection. Acute pancreatitis can lead to respiratory complications, such as pneumonia, due to the close anatomical relationship between the pancreas and the diaphragm and the systemic inflammatory response. Heart attack is not a direct complication of acute pancreatitis. Liver cirrhosis is a chronic liver condition not related to acute pancreatitis. Stomach ulcers are not a typical complication of pancreatitis. A patient is receiving intravenous furosemide. Which assessment is most critical to ensure the safe administration of this drug? A. Monitoring daily weight. B. Measuring urine output every hour. C. Checking blood pressure every 4 hours. D. Assessing for signs of dehydration. Correct answer. B. Measuring urine output every hour. Measuring hourly urine output is crucial when administering furosemide, a loop diuretic. Ensuring adequate renal function and monitoring for fluid and electrolyte imbalances are essential for safe administration. Daily weight monitoring helps assess overall fluid status, but is less immediate. Checking blood pressure is important, but does not provide direct feedback on renal function. Assessing for signs of dehydration is important, but not as immediate as monitoring urine output. An elevated troponin level in a patient with chest pain suggests which of the following? A. High blood pressure. B. Myocardial infarction. C. Cancer. D. Liver dysfunction. Correct answer. B. Myocardial infarction. Troponin levels rise when there is myocardial injury, making it a key marker for myocardial infarction. Elevated troponin is not associated with high blood pressure, cancer, or liver dysfunction. What is the priority nursing diagnosis for a patient diagnosed with congestive heart failure? A. Risk for imbalanced fluid volume. B. Acute pain. C. Impaired skin integrity. D. Ineffective peripheral tissue perfusion. Correct answer. D. Ineffective peripheral tissue perfusion. Ensuring adequate tissue perfusion is crucial in managing congestive heart failure to prevent complications. Fluid volume imbalance is a concern but secondary to perfusion issues. Pain and skin integrity are important, but not the primary concerns in heart failure. During a blood transfusion, a patient complains of chills and fever. What should be done first? A. Stop the transfusion. B. Increase saline infusion. C. Assess the patient's temperature. D. Notify the physician. Correct answer. A. Stop the transfusion. The immediate action is to stop the transfusion to prevent further reaction. Increasing saline infusion and notifying the physician are important, but come after stopping the transfusion. Assessing the temperature is necessary, but secondary to stopping the transfusion. Which lipid abnormality is most concerning for atherosclerosis and cardiovascular disease? A. High HDL cholesterol. B. Low triglycerides. C. Low LDL cholesterol. D. High LDL cholesterol. Correct answer. D. High LDL cholesterol. High LDL cholesterol is a significant risk factor for atherosclerosis and cardiovascular disease due to its role in plaque formation in the arteries. High HDL cholesterol is protective, and low triglycerides and low LDL cholesterol are not associated with increased cardiovascular risk. A patient with pulmonary edema due to heart failure is likely to exhibit symptoms related to fluid accumulation in which area? A. Abdomen. B. Lungs. C. Legs. D. Liver. Correct answer. B. Lungs. Pulmonary edema occurs when fluid accumulates in the lungs due to heart failure, leading to symptoms such as shortness of breath and coughing. Fluid accumulation in the abdomen, legs, or liver is not the primary concern in this context. After abdominal surgery, which is a significant risk that the nurse should monitor for? A. Impaired renal function. B. Psychological distress. C. Wound infection. D. Electrolyte imbalance. Correct answer. A. Impaired renal function. Post-operative patients are at risk for impaired renal function due to factors such as blood loss and hypotension. Monitoring renal function is crucial to detect and manage complications early. Psychological distress, wound infection, and electrolyte imbalance are important, but not the immediate post-operative risks. Which complication should be closely monitored in a patient diagnosed with chronic kidney disease? A. Hypotension. B. Elevated hematocrit level. C. Hyperkalemia. D. Flapping tremors. Correct answer. C. Hyperkalemia. Hyperkalemia is a common and dangerous complication in chronic kidney disease due to reduced renal excretion of potassium. Hypotension, elevated hematocrit, and flapping tremors are less specific to chronic kidney disease. What is an advantage of using an insulin pump over multiple daily injections for a diabetic individual? A. Shorter injection time. B. Use of a smaller gauge needle. C. Lower cost with reusable cartridges. D. Precise control of blood glucose levels. Correct answer. D. Precise control of blood glucose levels. Insulin pumps provide more precise control of blood glucose levels by delivering continuous subcutaneous insulin infusion. Injection time, needle gauge, and cost are not significant advantages compared to the precise glucose control offered by pumps. Which symptom should an individual with a colostomy report immediately? A. Liquid stool passing through the stoma. B. Occasional undigested food in the output. C. Slight fever of 37.6 degrees Celsius. D. No output from the colostomy for over 6 hours. Correct answer. D. No output from the colostomy for over 6 hours. An absence of colostomy output for more than 6 hours could indicate an obstruction, which needs urgent medical attention. Liquid stool, undigested food, and a slight fever are less immediate concerns. Before surgery for a planned splenectomy, what is the final assessment the nurse should perform? A. Verify name band. B. Confirm signed consent. C. Ensure the bladder is empty. D. Check vital signs. Correct answer. D. Check vital signs. Checking vital signs is the final critical assessment to ensure the patient is stable before surgery. Name bands, consent forms, and bladder emptying are important, but are not the final critical steps. Which intervention is contraindicated for a patient diagnosed with thrombocytopenia? A. Replacing depleted blood products. B. Administering heparin. C. Administering warfarin. D. Treating the underlying cause. Correct answer. C. Administering warfarin. Warfarin is contraindicated in thrombocytopenia due to its anticoagulant effect, which can exacerbate bleeding. Replacing blood products, administering heparin with caution, and treating the underlying cause are appropriate interventions. After brain surgery, which medication is expected to help reduce intracranial pressure? A. Diuretics. B. Blood pressure medication. C. Anti-seizure drugs. D. Steroids. Correct answer. D. Steroids. Steroids are used to reduce inflammation and prevent cerebral edema, thus reducing intracranial pressure after brain surgery. Diuretics, blood pressure medications, and anti-seizure drugs are used for other purposes. Which finding indicates that fluid replacement for a patient with hypovolemic shock is adequate? A. Urine output greater than 30 milliliters per hour. B. Diastolic blood pressure greater than 90 millimeters of mercury. C. Systolic blood pressure greater than 110 millimeters of mercury. D. Respiratory rate of 20 breaths per minute. Correct answer. A. Urine output greater than 30 milliliters per hour. Urine output is a sensitive indicator of adequate fluid replacement in hypovolemic shock. Maintaining urine output above 30 milliliters per hour suggests effective renal perfusion and fluid balance. Blood pressure and respiratory rate are important but less direct indicators. In a patient diagnosed with aplastic anemia, which physiological function should the nurse closely monitor? A. Bowel function. B. Sensory function. C. Bleeding tendencies. D. Fluid balance. Correct answer. C. Bleeding tendencies. Aplastic anemia leads to decreased platelet production, increasing the risk of bleeding. Monitoring for bleeding tendencies is crucial. Bowel function, sensory function, and fluid balance are important but secondary concerns. A patient with left-sided heart failure is likely to exhibit symptoms related to congestion in which area? A. Peripheral circulation. B. Pulmonary circulation. C. Right atrium. D. Systemic circulation. Correct answer. B. Pulmonary circulation. Left-sided heart failure leads to back pressure in the pulmonary circulation, causing pulmonary congestion. Peripheral circulation, right atrium, and systemic circulation are affected differently. What is the peak age range for acquiring acute lymphoblastic leukemia? All. A. 3 to 5 years. B. 13 to 19 years. C. 30 to 40 years. D. 50 to 60 years. Correct answer, A. 3 to 5 years. The peak incidence of all is between 3 and 5 years of age. It is most commonly diagnosed in children. When administering eardrops to an adult, which action should be avoided? A. Warming the drops to body temperature. B. Pulling the ear backward and upward. C. Positioning the patient on their side. D. Touching the ear canal with the dropper tip. Correct answer. D. Touching the ear canal with the dropper tip. The dropper tip should remain uncontaminated to prevent introducing bacteria, which could cause an ear infection. Warming the drops, pulling the ear backward and upward, and positioning the patient on their side are correct procedures. A patient with acute appendicitis who develops severe abdominal pain and a rigid abdomen is likely experiencing which complication? A. Gastroenteritis. B. Bowel obstruction. C. Ischemic bowel. D. Peritonitis. Correct answer. D. Peritonitis. Severe abdominal pain and a rigid abdomen suggest peritonitis, a serious complication of a ruptured appendix. Gastroenteritis, bowel obstruction, and ischemic bowel present differently. Which assessment finding should be reported immediately in a patient receiving magnesium sulfate for preeclampsia? A. Respiratory rate of 14 breaths per minute. B. Urine output of 40 milliliters per hour. C. Deep tendon reflexes of +1. D. Blood pressure of 140/90 millimeters of mercury. Correct answer. C. Deep tendon reflexes of +1. Hyporeflexia. Deep tendon reflexes of +1 may indicate magnesium toxicity and requires immediate attention. Respiratory rate, urine output, and blood pressure are important but less urgent in this context. Which behavioral characteristic is typical of a domestic abuser? A. Alcohol abuse. B. Excessive confidence. C. High frustration tolerance. D. Low self-esteem. Correct answer. D. Low self-esteem. Domestic abusers often have low self-esteem, which drives their need to exert control over their partners. Alcohol abuse, excessive confidence, and high frustration tolerance may be present but are not definitive characteristics. A 3-year-old child is admitted after frequent temper tantrums and food refusal. The parents note increased independence and frustration when unable to complete tasks. Based on Erik Erikson's stages of psychosocial development, which stage is the child navigating? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame and doubt. D. Industry versus inferiority. Correct answer. C. Autonomy versus shame and doubt. At around 3 years old, children are in Erikson's autonomy versus shame and doubt stage, striving for independence. Frustration when unable to complete tasks reflects this stage. A 55-year-old female with a history of Lyme disease presents with joint pain, fatigue, and cognitive disturbances after a recent tick bite. Which microorganism is most likely responsible? A. Borrelia burgdorferi. B. Streptococcus pyogenes. C. Bacillus anthracis. D. Enterococcus fecalis. Correct answer. A. Borrelia burgdorferi. Borrelia burgdorferi causes Lyme disease, leading to symptoms such as joint pain, fatigue, and cognitive disturbances after a tick bite. The other microorganisms cause different infections. A 48-year-old male with a bacterial respiratory infection, a history of Legionnaire's disease, and multiple sclerosis is prescribed azithromycin. For which condition should the nurse question the use of azithromycin? A. Recent bacterial respiratory infection. B. Past episode of Legionnaire's disease. C. Family history of Campylobacter infection. D. Long-standing diagnosis of multiple sclerosis. Correct answer. D. Long-standing diagnosis of multiple sclerosis. Azithromycin is effective against bacterial infections, including Legionnaire's disease. However, it does not treat multiple sclerosis, making this an inappropriate use of the medication. A 30-year-old female with a history of depression and anxiety mentions being on medication, but does not recall the name. Reviewing her medication list, which medication is likely prescribed for her conditions? A. Fluoxetine. B. Alendronate. C. Metformin. D. Digoxin. Correct answer. A. Fluoxetine. Fluoxetine is an SSRI commonly prescribed for depression and anxiety. Alendronate treats osteoporosis, metformin is for diabetes, and digoxin is for heart conditions. A 4-year-old child is hospitalized after a minor accident at daycare. The child is hesitant to play with the hospital's child life specialist and often asks if it is okay to use certain toys. The parents note that the child was previously very active and curious. Based on Erik Erikson's stages of psychosocial development, which stage is the child navigating? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame and doubt. D. Industry versus inferiority. Correct answer: B. Initiative versus guilt. At around 4 years old, children are in Erikson's initiative versus guilt stage, where they begin to assert control and make decisions. Hesitation reflects their struggle with initiative. A nurse admits a client with severe anxiety. What is the priority nursing diagnosis? A. Nutritional imbalance. B. Ineffective coping. C. Risk for injury. D. Social isolation. Correct answer: C. Risk for injury. Risk for injury is the priority concern for a client with severe anxiety due to potential panic attacks or unsafe behaviors. Ineffective coping, nutritional imbalance, and social isolation are important but secondary. While planning care for a 3-year-old hospitalized child, which factor is most likely to affect the child's behavior? A. New bed and surroundings. B. Separation from parents. C. Presence of other children. D. Unfamiliar toys and activities. Correct answer: B. Separation from parents. Separation anxiety is a significant stressor for toddlers during hospitalization. Being separated from parents can cause significant distress and affect behavior. A 19-year-old college student is found unconscious in her dorm room with a fever and rash. What is the first diagnostic test likely performed? A. Blood glucose test. B. CT scan. C. Blood cultures. D. Arterial blood gases. Correct answer: C. Blood cultures. Blood cultures are essential to identify the causative pathogen in cases of suspected systemic infection, such as sepsis or meningitis, which present with fever and rash. A 58-year-old male with chronic kidney disease and a recent episode of hyperkalemia presents with palpitations and fatigue. Which of his reported symptoms is least likely related to hyperkalemia? A. Slow heart rate. B. Paresthesias. C. Muscle weakness. D. Weight gain. Correct answer: D. Weight gain. Weight gain is not typically associated with hyperkalemia. Slow heart rate, paresthesias, and muscle weakness are common symptoms due to potassium's role in muscle and nerve function. A 4-month pregnant woman reports having multiple sex partners and is unsure of the baby's father. Which nursing intervention is a priority? A. Counsel the woman to consent to HIV screening. B. Perform tests for sexually transmitted diseases. C. Discuss her high risk for cervical cancer. D. Refer the client to a family planning clinic. Correct answer: A. Counsel the woman to consent to HIV screening. The woman's behavior places her at high risk for HIV, which can have severe implications for both her and her unborn child. Early identification and intervention are crucial. A 10-year-old admitted to the burn unit requires fluid replacement. Which assessment indicates adequate fluid replacement? A. Urine output of 30 milliliters per hour. B. No complaints of thirst. C. Normal hematocrit levels. D. Good skin turgor around burn. Correct answer: A. Urine output of 30 milliliters per hour. Adequate urine output is a key indicator of effective fluid replacement in burn patients, suggesting sufficient renal perfusion and fluid balance. When devising an educational plan for a patient newly diagnosed with migraines, which critical points should be included? Select all that apply. A. Avoid foods high in tyramine, such as aged cheese and alcohol. B. Avoid medications like cimetidine, nitroglycerin, and nifedipine. C. Target pain relief at the onset of aura symptoms. D. Be aware of rebound headaches as a potential side effect. E. Consider complementary therapies like relaxation techniques. Correct answers: A, B, C, D, E. Patients should be educated on dietary triggers, medication interactions, early intervention with abortive therapy, potential rebound headaches, and complementary therapies for effective migraine management. A 30-year-old female presents with red, itchy eyes and yellowish discharge after returning from a trip abroad. Suspecting bacterial conjunctivitis, which microorganism is likely responsible? A. Yersinia pestis, B. Helicobacter pylori, C. Vibrio cholerae, D. Haemophilus aegyptius. Correct answer, D. Haemophilus aegyptius. Haemophilus aegyptius is a common cause of bacterial conjunctivitis, especially in travelers. The other microorganisms cause different infections. A 60-year-old former athlete is admitted for knee replacement surgery. He lives alone in a 2-story house and worries about his mobility and self-care after surgery. When should discharge planning start to ensure his smooth recovery? A. Right after surgery. B. At the time of admission, C. 48 hours before discharge. D. During the preoperative consultation. Correct answer, B. At the time of admission. Early discharge planning at the time of admission allows the healthcare team to comprehensively assess the patient's needs and arrange necessary support services for a smooth recovery. A 48-year-old female with type 1 diabetes presents with fatigue, increased urination, and difficulty breathing. Suspecting diabetic ketoacidosis, which symptom is atypical for this condition? A. Persistent nausea leading to vomiting. B. Extreme thirst despite drinking water. C. Significant weight gain over a short period. D. Fruity odor on her breath. Correct answer, C. Significant weight gain over a short period. Weight gain is not typically associated with diabetic ketoacidosis. Instead, weight loss is more common. Persistent nausea, extreme thirst, and a fruity odor are classic symptoms of diabetic ketoacidosis. After a patient with migraines experiences a seizure, which task can be assigned to a nursing assistant? A. Record the details of the seizure. B. Conduct neurological assessments. C. Measure the patient's vital signs. D. Restrict the patient's movements for safety. Correct answer, C. Measure the patient's vital signs. Measuring vital signs is within the skill set of a nursing assistant. Recording seizure details and conducting neurological assessments are nursing responsibilities, and restraining the patient is not recommended. Which playroom activities are appropriate for a group of 7-year-old hospitalized children? A. Sports and games with rules. B. Finger paints and water play. C. Dress-up clothes and props. D. Chess and board games. Correct answer, A. Sports and games with rules. For 7-year-olds, play that involves cooperation and rules is developmentally appropriate. Engaging in sports and games with rules helps develop logical reasoning and social skills. During a school health fair, a nurse records vital signs for students from various age groups. Reviewing the data, the nurse identifies one set of vital signs that seems abnormal. Which vital signs are outside the typical range for the respective age group? A. 12-year-old male athlete who just finished a sprint. 90 beats per minute, 22 respirations per minute, 100 over 70 millimeters of mercury. B. 14-year-old female student anxious about an exam. 106 beats per minute, 24 respirations per minute, 108 over 48 millimeters of mercury. C. 6-year-old male student who was running with friends. 102 beats per minute, 24 respirations per minute, 90 over 65 millimeters of mercury. D. 8-year-old female student calmly coloring. 100 beats per minute, 26 respirations per minute, 90 over 70 millimeters of mercury. Correct answer, B. 14-year-old female student anxious about an exam. 106 beats per minute, 24 respirations per minute, 108 over 48 millimeters of mercury. Normal vital sign ranges vary by age. For 14-year-olds, the typical heart rate is 60 to 105 beats per minute, respiratory rate is 12 to 20 respirations per minute, and blood pressure ranges from 85 to 120 systolic and 55 to 80 diastolic. The 14-year-old female's heart rate and respiratory rate are slightly elevated due to anxiety, but the diastolic blood pressure of 48 millimeters of mercury is below the expected range, indicating potential hypotension. While explaining an illness to a 10-year-old, what should the nurse consider about cognitive development at this age? A. They are able to make simple associations of ideas. B. They are able to think logically in organizing facts. C. Interpretation of events originates from their own perspective. D. Conclusions are based on previous experiences. Correct answer. B. They are able to think logically in organizing facts. According to Piaget, children around the age of 10 are in the concrete operational stage of cognitive development, where they can think logically and systematically about concrete events and organize facts coherently. A nurse is providing discharge instructions to a patient with a long leg cast. Which type of exercises should the nurse recommend for the affected extremity? A. Isometric. B. Range of motion. C. Aerobic. D. Isotonic. Correct answer. A. Isometric. Isometric exercises involve contracting and relaxing muscles without moving the affected joint, ideal for maintaining muscle strength in an immobilized limb. A 16-month-old child admitted to the hospital clings to the mother and cries when the nurse enters the room. What should the nurse do initially? A. Arrange to change client care assignments. B. Explain that this behavior is expected. C. Discuss the appropriate use of timeout. D. Explain that the child needs extra attention. Correct answer. B. Explain that this behavior is expected. Fear of strangers and separation anxiety are normal developmental stages for toddlers. The nurse should reassure the parents and provide strategies to help the child feel more comfortable. An 85-year-old male experiencing reduced mobility and weight gain over the last 2 months keeps his heater on constantly. Which diagnostic test is most likely performed? A. Complete blood count. B. Electrocardiogram. C. Thyroid function tests. D. Computed tomography scan. Correct answer. C. Thyroid function tests. Symptoms of weight gain, decreased mobility, and heat intolerance can indicate hypothyroidism. Thyroid function tests measure thyroid hormones and thyroid-stimulating hormone to diagnose thyroid dysfunction. A 20-year-old is admitted after a motor vehicle accident. The patient is distressed over a recent breakup and feels isolated from peers. The parents report the patient has been avoiding family gatherings. Based on Erik Erikson's stages of psychosocial development, which stage is the young adult navigating? A. Trust versus mistrust. B. Initiative versus guilt. C. Autonomy versus shame and doubt. D. Intimacy versus isolation. Correct answer. D. Intimacy versus isolation. Young adulthood is characterized by Erikson's stage of intimacy versus isolation, where individuals seek to form close relationships. The patient's distress and isolation reflect struggles with this stage. A 30-year-old male presents with severe headache, neck stiffness, and confusion. His roommate mentions flu-like symptoms in recent days. Suspecting acute meningitis, which symptom is least expected? A. Increased appetite. B. Vomiting. C. High fever. D. Sensitivity to light. Correct answer. A. Increased appetite. Increased appetite is not typically associated with acute meningitis. Symptoms like severe headache, neck stiffness, confusion, vomiting, high fever, and sensitivity to light are common signs of meningitis. As you prepare to admit a patient with a history of seizures, which task is appropriate for an LPN or LVN to handle? A. Perform the initial admission assessment. B. Arrange for oxygen and suction equipment. C. Place a tongue blade at the bedside for emergencies. D. Pad the bed rails before the patient's arrival. Correct answer. B. Arrange for oxygen and suction equipment. LPNs and LVNs are qualified to set up necessary medical equipment. The initial admission assessment is the responsibility of a registered nurse. Tongue blades should not be used for seizure patients, and padded side rails are debatable. A client is discharged after hospitalization for congestive heart failure. The nurse advises the family to encourage the client to rest in which position? A. High Fowlers. B. Supine. C. Left lateral. D. Low Fowlers. Correct answer. A. High Fowlers. Resting in a high Fowlers position, sitting upright, helps reduce cardiac workload and facilitates breathing in clients with congestive heart failure. When educating a patient and their family about epilepsy before discharge, which statement warrants correction? A. Refrain from drinking any alcohol. B. Always wear your medical alert bracelet. C. Ensure the airway is clear during a seizure. D. Over-the-counter medications are safe to use. Correct answer. D. Over-the-counter medications are safe to use. Patients with epilepsy should consult their physician before taking over-the-counter medications due to potential interactions. A nurse is caring for a patient with migraines. What is the primary nursing focus for this patient? A. Intense pain due to biological and chemical factors. B. Anxiety stemming from health status changes. C. Hopelessness due to worsening physical condition. D. Risk of adverse effects from medical treatment. Correct answer. A. Intense pain due to biological and chemical factors. Managing acute pain is the primary concern for patients with migraines, as it is often debilitating. An 80-year-old female with increased confusion and falls over the last 2 weeks, along with mild left hemiparesis, is admitted to the hospital. Which diagnostic test is most likely performed? A. Complete blood count. B. Electrocardiogram. C. Thyroid function tests. D. Computed tomography scan. Correct answer. D. Computed tomography scan. A computed tomography scan is often performed to investigate neurological symptoms such as hemiparesis and confusion, assessing for conditions like stroke or mass lesions. Excellent work! We covered a lot of important topics today. Keep practicing, and remember to review these rationales to understand why each answer is correct. See you next time.